Hey everybody, I'm Dr. Walt Jernigan, and welcome back to PS 113, Introduction to Psychology, Chapter 12, Psychological Disorders. In Part 1, we're going to go over key concepts including intern syndrome, the definition of a psychological disorder, and general diagnostic criteria. Now we're getting into the really good stuff. Chapter 12 on psychological disorders, as well as Chapter 13 on therapy, is collectively known as abnormal or clinical psychology. Many of you at the beginning of this semester probably thought that this is what psychology is all about. This is my professional background, and we're the doctor kind of psychologists who treat patients in private practice, in the clinic, or in the hospital. But before we go any further, I want to issue a word of caution about intern syndrome. Intern syndrome is named for a phenomenon seen in medical and nursing students. When learning about the specifics of medical disorders, sometimes the student will think, I've had that symptom or I've had that feature. Does that mean I have the disease? Well, the answer, of course, is usually no. The same thing happens in psychology courses. We're going to discuss a lot of unusual patterns of thoughts, feelings, and behaviors. But you should be careful not to diagnose yourself. This course is not about diagnosing yourself, family, friends, or others. That said, the odds are that some of you have been in a counseling or treatment situation, and you already know about a diagnosis label that's been attached to your problems or difficulties from discussions with your therapist or doctor. That's fine. But for anyone else, please don't jump to any conclusions. If you do have questions or concerns, feel free to see a counselor in the counseling office here at NMJC, or even come by and visit me. I don't provide psychological services in my role at the JC, but I can certainly listen and steer you in the right direction. So, let's begin. What is a psychological disorder? We're going to define a psychological disorder as mental processes or behavior patterns that cause significant distress and or substantial impairment in functioning. Now, that's a mouthful, isn't it? Well, let's break it down. It basically comes down to, are you majorly distressed, and or are you having great difficulty in your functioning, whether it's with friends, family, or on the job? Where do we draw this line between what's normal versus what's abnormal? It's not unusual for any one of us to get the blues 1 or 2 days a month. Does that mean you suffer from depression? Have you ever lost a night's sleep because of tossing and turning, and you're worried about an exam, a job interview, or something else the next day? Does that mean you suffer from anxiety? To begin our discussion, psychologists like me use several broad stroke criteria to diagnose psychological problems. And these include, is the behavior or mental process considered strange or unusual within the person's own culture? Does the behavior or mental process cause significant personal distress? Is the behavior maladaptive? And finally, is the person a danger to self or others? Let's go over these in a little more detail now. Our first broad stroke criteria is the behavior or mental process considered strange. Look at the woman here. She's having a good time, isn't she? Is there anything unusual or strange about her behavior in a club on Saturday night? Well, of course not. This is normal. This is what we would expect. But would the same behavior 12 hours later be normal in this setting on Sunday morning? Of course not. This is the behavior we expect in church, isn't it? But if this same person suddenly dropped to their knees, began to pray or speak in tongues in this setting, then that behavior turns bizarre, doesn't it? So you see, what you do and how you think are always interpreted in the context of the environment and the surroundings. A behavior in one setting could be judged normal, but at another time and in another place, it could be considered abnormal. The second criteria is, does the behavior or mental process cause personal distress? A person may say things such as, I'm unhappy, or I can't go on like this, or I am in such deep emotional pain. Also, seeking professional help or consultation with a mental health professional can certainly be a way of signaling this distress. A third criteria, is the behavior maladaptive? Or, as we say in the profession, does it cause significant impairment in your functioning? By the way, this is the single most important general criteria that we use. So let me repeat this. Is the behavior maladaptive? Is it impairing your functioning? Emotional distress in the second criteria above is important, don't get me wrong. But the bottom line always is, how are you functioning? Has your functioning gone downhill? Is a person who once made A's and B's in school now making D's and F's? Is a person who once was a reliable and productive worker now been fired because of poor job performance? A fourth criteria, is the person a danger to self or others? And this can be manifested in any number of ways. A person may be straight out suicidal. Another person may be dangerous to others because they're homicidal. And yet a third person may be dangerous to self because of extremely poor judgment. You know, it seems once or twice a year I read an online account about somebody who jumps over the wall into the lion or tiger exhibit at a zoo, and his last words were, "Don't worry, I can talk to the animals. I'm going to save them and convert them to Christianity." The person is then injured or mauled to death. He may not have been suicidal, but his thinking was so deranged that he unknowingly put himself in harm's way. And finally, another sad situation is that a person can be gravely disabled by a mental disorder and need protection. A person in end-stage Alzheimer's, for example, is unable to take care of herself in terms of feeding, bathing, and hygiene, let alone making decisions over money because of cognitive deficits. I want to mention another criterion that is often used by the courts, but strictly speaking is not a psychological determination. It is a legal definition, and that is the person legally responsible for his or her acts? This is a fascinating area of study, and you probably heard the term the insanity defense. The insanity defense may be raised when there's absolutely no doubt that the defendant committed a heinous and bizarre crime that they're accused of, but he claims to be not guilty by reason of insanity because of impairment from a major mental disorder and cannot judge right from wrong. Well, we've come to the end of part one. We have defined a psychological disorder and looked at several broad stroke criteria. How do we make specific diagnoses of other disorders? And that'll be the topic of part two. We'll see you then. Bye-bye.